internally, we have the ability to heal, but we have to recognize, we have to create the right environment. Applying these therapeutic interventions, seeing bone often in the tibia or elsewhere in the spine or in the rib cage, in the head, changing within a few minutes. Bone deterioration that was not healing for years, within a few treatments, you had normal bone returning, bone changing shape, coming back to normal size and shape. Fractures that they thought were there, either they looked at it afterwards, they say, oh, wait a sec, this must be a really old fracture. He said, no, this happened a few days ago. Or the fact that they couldn't even find the fracture line after we treated them. I said, okay, let me look at some basic, simple devices that might be able to stimulate human frequency and maybe broadcast that out into a larger field. And we came up with a device which we call the Safe Stone. Then one of my students lent it to a friend of hers. This goes back about 3 years ago when we first started developing the device. Her friend's son was born with a brain injury. He had epileptic seizures from the day he was born, 10 to 20 seizures a day. She gave him this device. He had had seizures like that for 17 years. He was 17 years old. Within 24 hours or less of turning on the Safe Zone, he stopped having seizures.
Hey everyone, geophysicist Stefan Burns here with an amazing conversation lined up for all of you today with Dr. George Roth, an expert in bioelectromagnetism and the practical application of bioelectricity for improving health and wellness, and even to perform what some would call miraculous healings where all other methods have failed. Because bioelectricity is the blueprint of the body, so by working with the natural bioelectrical system, you can achieve some health outcomes which are really quite remarkable and incredible. So 2 things before we get into it, just to note, if you're watching this video soon after release from April 10th to the 15th of 2025, there is an EMF Summit that is going to be online, available to everybody. And so if you'd like to learn more about that, to hear from 18 different speakers on electromagnetic fields, health and wellness, and more, then you can sign up. There is more information in the video description. And also, Dr. George Roth highlights a couple different devices that he uses to achieve some of these health outcomes. His website is matrixrepatterning.com and then also wellnesssystems.com. And I personally like to try things out before I vouch for them. So if this information and this just resonates with you in general, then you can learn more about this at those websites. You can check out these devices at wellnesssystems.com. He did provide everyone a coupon code for a discount. This is Stefan Burns, all one word, but I myself have not used them yet. He has sent these devices to me. I'll be testing them out myself soon, but as I'm filming this right now, I still have not tested this out, though I've done a lot of research into these things and I know that there's some really good science behind it. So again, if this resonates with you, then use the coupon code Stefan Burns at the Wellness Systems website to check out any of these products and you will receive a nice discount because of that. So with that, let's get right into it. Today we're going to be discussing bioelectricity, health and wellness, how you can heal and regenerate your body and injuries and tissues using a fundamental understanding of how electromagnetism works within our body. And we're also going to play in some interesting areas, for example, with geomagnetic energies like the magnetic field and how that's moving and Schumann resonances and more. So hello, George, and welcome to the channel.
Oh, thanks so much, Stefan. I've been totally engrossed and amazed by your presentations, and it tied in so closely with what I've been exploring for now over 45 years in terms of looking at the body and then ultimately realizing that there's so much of a connection with the bioelectric realities that we're living in, and realizing that a lot of the things I was looking at as a practitioner, and my background is in chiropractic, osteopathy, and naturopathic medicine. And so looking at observations that I had many, many years ago, this is almost 50 years ago, I was teaching human dissection, and noticing that there were big differences from one side of the body to the other in terms of bone size. And that caught my attention, and I realized that no one really understood it. And ultimately, it turns out that this is a feature of injury that we just didn't know existed. And it was confirmed actually at the University of California in 2005. They actually used very powerful microscopes and confirmed that finding, how many years later after I looked at it observationally. So anyways, from that point of view, then I started to understand that bone is not what we think it is. Within bone, there's a flexible framework made of collagen. And collagen, I think, has been studied as a uniquely bioelectric tissue. It is a semiconductor. And what we think happens with collagen in certain areas of the body when it's injured, it actually distorts and expands, and therefore it loses some of its semiconducting properties. It can actually interrupt that current, which the body, in my opinion, needs. Every cell functions as a bioelectric little battery, and all of that information is transmitted from cell to cell. We talk about stem cell therapy and all the things we talk about with healing. Underlying that is the bioelectric principle. And then we live in a bioelectric environment, which you talk about. And guess what? We messed it up. And so here we are now. I realized about 8 or 9 years ago, when we were looking at these bioelectric changes to assess and treat the body, all of a sudden we were noticing we couldn't find these bioelectric signals. And it was around that time when all of the more powerful technology was starting to come on the scene: smartphones, smart devices, powerful Wi-Fi routers, ultimately 5G, higher intensity and frequency devices, which were completely non-biocompatible and interfered with the functioning of the cells. And more evidence is mounting for that. But for our work, at least, it was something that I had to address. Ultimately came up with some solutions which turned out to be very beneficial for many people in terms of their health. I did it strictly to help our process so we could help resolve injuries. And so anyway, I'll tell that story when we get to that point, but it's kind of interesting how that kind of evolved. So now I'm a bioelectric junkie and electromagnetic and Schumann resonance, because all of that, we live in this reality that we have to align with or not at our peril, right?
Yeah, I'm really excited to dive into some of the case studies and some of these healings that you've done in regards to someone has basically an injured knee and then just this massive regeneration occurred. And the reason, I have a personal interest in bioelectricity is because I've always had an interest in biology. I could have easily gone into the biological sciences instead of geology and geophysics. And just having an open, curious mind, I pretty soon found the connection between them. And I'm not the first one. You're not the second one or first one, right? There's people that have been looking into this for decades and, in fact, much longer than that, right? But they are kind of these separate fields, and so you don't get that much overlap. So there are papers out there you can read, there's books out there that you can read, but the average person or even someone that's going to school for one or the other typically doesn't connect the two, which is really unfortunate because we are a part of our environment and we also influence our environment. I think that's very nicely demonstrated by the fact that Earth produces these natural energy vibrations called Schumann resonances. The frequencies are like 8 hertz, 14 hertz, 20 hertz, and they go on from there, decreasing power. It's the same exact frequency range as our brain waves. They both have the same intensities. We actually see dominant power at Schumann frequencies in the brain. So it's not that they just overlap, they also preferentially kind of mold to that frequency structure. So that tells you something right there. And then you could find like a dozen plus 100 plus other examples. And as I started researching into bioelectricity more, it started to become clear that this is more like the underlying code for just how the body operates. They have a lot of studies where they change cellular voltage gradients across cells. And so this is, you have one voltage potential, let's say like 50 volts over here, another, it's 10 volts. What's the gradient between that? We're keeping it really simple. And changing that gradient will change the expression of a cell, especially stem cells. And so that's fascinating. It shows that not only does the cell's individual or group behavior of cells change, that's actually one of these things that's guiding the expression of DNA. They've shown that DNA is conductive, and so it's connecting to this electromagnetic field in ways that we still don't fully understand, and that's what's guiding the generation of proteins and all this. So it's a huge open field, and the geophysical energies are in many ways are guiding that. But now it's also us, as you touched on, because of this plethora of artificial electromagnetic smog, electropollution that's been created. And people think, for example, that microwaves they just cause heating, right? They cause a molecule to vibrate. Let's say a water molecule, you put your food in the microwave and it warms up. They think it's just because of the rotation of a water molecule, it heats up. But there are other effects that are non-thermal as well for microwaves, and the frequency range for 5G, for example, now has entered into that zone where it is absorbed by water to a much greater degree. The electric susceptibility just really grabs onto anything that's over basically gigahertz. And so, yeah, I'm not surprised that you in your practice all of a sudden notice a change in people as 5G started to get rolled out, which was, really started getting rolled out like 2019 or so, but even before then. So yeah, let's start there. I mean, just what type of changes? I mean, you're seeing that people aren't able to heal their injuries as well. They're lingering more often, but are you seeing anything else as well with just like the huge increase in electropollution, not only from cellular networks, but also from our devices, which are running out the same frequencies, and there's a whole bunch of them now in the house and beyond?
Yeah. Yeah, I would say that, to just kind of give it a background here, first of all, there's an old Star Trek reference that I love. And it goes back to, I believe it was The Next Generation. There was a group of silicon-based life forms that took over the computer. And when they took over the computer, they could speak to humans. And their reference to humans was as ugly bags of mostly water. And that's the one I love, because it's like it basically highlights the fact that as we start to get in these higher frequencies, as you say, our tissues, which are mostly water, basically within intracellular, extracellular water, is very, very susceptible to the increased biological effects. And we know structured water, we know that water orients itself within cells certain ways. And again, like, we don't know all the answers, but we do know that when we diverge further and further away from nature, we get into huge problems, and then we start to see all these diseases emerging. So for me, the story goes back years ago when I was looking at, different disciplines within osteopathic medicine, other things, and no one could really explain why the body was responding to injury in certain ways or how it could even be healed. And I had the luck to encounter a couple of amazing scientists over the years. Dr. Stephen Levin is an orthopedic surgeon, wrote the foreword to my first book. This is a medical text. And Dr. Donald Ingber, he's a researcher from Harvard, a cell biologist. Both around the same time in the mid to late 70s, were exploring this idea of biotensegrity, the idea that all of our cells are linked internally and externally by a protein and fibrous framework called the matrix. That's why my technique is called matrix repatterning, is because when you disrupt the matrix anywhere, you disrupt it everywhere. So a good little exercise anyone can try is, if you sit comfortably with your eyes closed for a moment and just notice the neck, your neck and shoulder tension, and then just go ahead and clench both your fists, okay? And notice the change in the sensation of tension in your neck and shoulders. So it's instantaneous. The fist clench basically simulates an injury somewhere else in the body. And so all of a sudden we get symptoms somewhere. We say, oh, what happened? What did I just do? But you don't realize that maybe 2 weeks ago you stubbed your toe. Or in certain cases we see, people go to the dentist and they get a dental extraction or a filling done, and there's a lot of trauma in the mouth. There's massive fascial, but also neurological connections that the body reacts to. And so this connection in the body, which is why referred to as how the matrix interprets energy. Matrix is mechanical and also electromagnetic. I refer to the matrix as the internet of the body. It basically transmits information. We believe at least electromagnetically, but also electronically, and likely there's a photonic effect. There seems to be photons that are transmitted between cells in different ways. And when you change the mechanics, you change the communication system. And I think that's really what's been, the evidence is pointing to that. Okay, I don't have all the direct evidence, but when I interpolate all of the different pieces of the puzzle, that's what seems to come together. So anyways, from a clinical point of view, we started applying these principles, and lo and behold, things that we noticed, like when I made these observations about bone changing. By the way, bone enlarges, this structure enlarges. There's almost like a quantum shift within the protein structure that was demonstrated or verified by that study at University of California by applying a combination of piezoelectric principles, both gentle pressure plus a normalizing bioelectric field, which in a sense kind of supported the body's own natural frequencies, which are within the Schumann range. All of a sudden, the bone started going back to normal. I mean, we were shocked, quite frankly. And people, I teach this, by the way, to practitioners all over the world, and they're getting the same results. They're seeing it happen before their eyes. And we're talking about minutes here, applying these therapeutic interventions, seeing bone often in the tibia or elsewhere in the spine or in the rib cage, in the head, changing within a few minutes, like dramatically, where we can measure them. We can see them externally. We change facial structures. We've had people's facial recognition software stop working immediately after treatment. Measurements on X-ray. We have X-ray evidence for that that has shocked radiologists because when they look at, someone, even they thought of bone deterioration that was not healing for years, within a few treatments, you had normal bone returning, bone changing shape, coming back to normal size and shape. Fractures that they thought were there, either they looked at it afterwards, they say, oh, wait a sec, this must be a really old fracture. He said, no, this happened a few days ago. Or the fact that they couldn't even find the fracture line after we treated them. It's wild stuff. So the body is basically self-assembling. We know this from so many other studies that when you line up collagen in a certain way, a good example of that, by the way, is people are familiar maybe with the idea of the big airships that they were building back in the 20s and 30s, especially in Germany. And people don't realize that they didn't have the technology to contain hydrogen, a tiny, tiny molecule. They didn't have the materials. And so do you know what they used for the airships?
No, please enlighten me.
They used cow intestine.
I was thinking
Okay.
something that may be the case, but wasn't
Yeah,
sure.
yeah, exactly. They took cow intestine and they basically, I think they shut down the sausage industry for a couple of years, basically to collect all of that. And they laid it all out, cleaned it up, and basically all they had to do to seal it was to take two layers of it and basically overlap them slightly. And this was not living tissue. This was collagen that basically primarily, in that tissue. And it literally would self-assemble and re-establish a perfect seal between those overlapped segments. And so some people cook bacon and they'll notice, when if the bacon lies on top of another slice of bacon, it's going to start to adhere to it. That's exactly what happens here. So basically, this self-assembling, self-healing property is always there. All we have to do is create a better environment so they can restore that communication. I've connected this therapeutic principle really to stem cell therapy for that reason, because when you reestablish communication of stem cells, for example, are injected into undifferentiated cells into damaged areas of the body, and they literally learn from the surrounding cells how to behave, to become a liver cell or a pancreas cell or a nerve cell. Like, it's crazy. All the same genetic material, right? But there's specific information within each tissue that has to be communicated to its neighbors. When it doesn't do that, we have a condition called cancer. All right. So it's interesting how, and when you look at a lot of primary cancers, they do happen, according to Dr. Donald Ingber, a researcher at Harvard, who's contributed to my other book on matrix repatterning. He basically noticed that this was happening in areas of injury, okay, where there is that disruption of communication. So anyway, so applying these principles, and by the way, many of the miraculous healings that we talk about were performed by practitioners that I trained over the years. Like, these are some of the most amazing stories that we see. For example, there's an incredible case. We had an opportunity to see one of my colleagues, Oliver, who is one of our instructors. He treated a young girl who, at the age of 9, had several fractures to her tibia to the point where it would not heal. And so they essentially, what's called a non-union, okay, of a fracture. So they diagnosed her with a horrible condition called fibrous dysostosis or fibrous dysplasia, and her bone became like lace. It wouldn't integrate. They had to put a metal rod in. You see some of these images at some point. Anyways, and so that had been going on for 5 years before he saw her at the age of 9. And sorry, he saw her at 15. The fractures happened at age 9. He saw her almost 6 years later, and the X-rays were just devastating. She could not walk unassisted. She needed a walker at the ripe old age of 15. And so then he applied our principles, and within 6 treatments, normal, healthy bone. They were shocked, okay, to say the least. The rod has now been removed. She's walking like a normal person. And this is the kind of thing that we are seeing consistently. That was a dramatic example. We had the opportunity to have a little spotlight on, but young people with injuries to bone structures like the knees or the wrist or whatever, X-rays. For example, we have a young hockey player who had a completely displaced growth center in his wrist after hockey injury, basically. And so they were expecting to do surgery. And the mother, who we had treated the kids before, at that time, my office was just around the corner from the hospital. So while they were getting ready to do a temporary cast, she said, "Okay, I'll be right back." She ran over to our office. One of my students treated the son who had the fracture, and they went back and put the cast on, and they couldn't believe it. And the comment by the radiologist was, "This was set by the gods." And all we did was normalize. People think the fracture is the problem, but when he drove his arm into the boards, basically his whole arm was disrupted. The bone structure could not allow that fracture segment to line back up, right? So they believed they would have to use, surgery with metal rods and bolts and plates and all this stuff. And he would never have proper use of that wrist, right? After that, there's no way. And here he is, probably 10 years later now after the fact, he's got perfect functioning of that wrist, the kind of thing we see all the time. And so bone is a big area, but the other big healing that takes place, because bone also protects some of the most vital structures in the body. So if you think of what are the most protected areas in the body, all right? The nervous system, cranium, the spinal cord, the spine. That is huge because the communication system is vital. And by the way, nerve cells are the hardwired communication system, whereas the matrix, which is this fibrous interconnected framework, I call it the internet. And we've got some pretty good evidence that the body can actually bypass the nervous system in order to establish communication as well. So to make a long story short, then we started noticing that when we corrected the spine and the cranium, people who had neurological conditions, including paralysis, quadriplegia, paraplegia. Well, we had one case of a quadriplegic who improved. He was in a horrible car accident. My students in Minnesota started treating him. He got the use of his arms back. He was in intensive care in a hospital after a horrible car accident. And he showed up, he actually became a student of Matrix, showed up in a wheelchair at one of our seminars. This goes back many years ago. And he basically had still not recovered his lower extremity function. So during the seminar, he said, why not? We'll treat him. He didn't have cord transection. Like when the cord is actually severed, it's different. This was basically trauma that created fluid pressure around the spine. Okay, it happens a lot more than people think. And so when we corrected that spinal injury lower down in the spine, he started moving his legs during the seminar, you know, and that's remarkable. And for head injuries, we've been basically singled out as, according to Dr. Norman Deutsch, who wrote a couple of books, one called The Brain That Changes Itself. He's a very well-known researcher in the field of traumatic brain injury. And so he read my book many years ago and found out, and I was treating head injuries. So he contacted me and started evaluating patients and actually took some of the training. And so his evaluation was that we were able to actually reverse many of the effects of head injury by creating a better environment, by restoring the shape of the skull, taking stress off of the nerves and the blood vessels. We were allowing people to recover from concussions much more quickly. And so that was basically his evaluation. And he actually witnessed some acute cases where people literally just had injuries like 24 hours prior to that. And they were able to recover function when we got to it quickly. So his comment was that matrix repatterning should be in hospital emergency departments, which it isn't yet, but I hope it will be one day. We've had a few medical doctors take the training, veterinarians, we treat animals and horses. And so physical therapists, chiropractors have been studying this. So they've been getting just as good results as we are. You know, in our clinics, I have, you know, residents in my clinic who come through and we do some more in-depth training. One of the really interesting cases years ago that I treated was a pair of twins who I had treated the whole family. So by the time I saw them, I think they were around 5 months old. But from birth on, they had developed a condition called neutropenia, which is basically they lost one of the main white blood cell levels in their blood. So they're very susceptible to infections as a result of that. And so as a result, their mother, who's a periodontist, actually had to give them injections every, I think twice a week or something like that to maintain the white blood cell levels. They had, I guess they got donor blood to supply that. And anyways, by the time I saw them, I didn't have any idea if I could do anything. I said, okay, let me check them. And there was confidence from the family. I saw the parents and grandparents and prior to that. So when I assessed them, I said, what the heck's going on here? Both of them had massive injury patterns that we could detect around the area of the spleen. And so it's a common injury, by the way, but I wouldn't have expected to see it in a very, very young child, you know, unless they both had significant traumatic, like impact injury, like you see in car accidents, people rupture their spleens and so on. And they do develop, you know, abnormalities like this, including a loss of platelet levels. So anyways, I said, okay, I'm not sure why. And the mother seemed like a very loving mother. I didn't suspect her of child abuse. So anyways, from there, I just wondered why. So anyways, so I went ahead and treated them and realized that the spleens were very enlarged. I treated that. But one of the interesting things was one of the twins had what's called an omphalocele, which is basically a huge hernia coming out of the umbilical area. And by the way, that ties in really closely with what I've been noticing over the years with the electromagnetic changes on the earth. And other people, including obstetricians, have noticed that there is an increasing incidence of umbilical problems and positioning of the fetus in the womb over the last 30 or 40 years, an increasing rate of malpresentations, umbilical problems, cords around the neck, around the body, even to the point where it's actually shutting down the function and the nutrition coming from the umbilical cord. So anyhow, this is something that I learned about years ago. I said, why is this happening? And I started to then connect the dots. As the magnetic field, I believe, is weakening, we're seeing a difficulty in the fetus being able to line up with the mother's magnetic field and therefore positioning properly for delivery. And so we think they keep spinning in the womb as a result of that, which actually adds a distortion in through the entire framework of the child. Now, apparently, according to obstetricians I'm talking to, apparently 1/3 of all newborns are being born with torticollis, which is distortion of the neck, and a type of scoliosis. This is a distortion that's a torsional distortion that's becoming much more prevalent in the last 10 years. So it's an accelerating problem. Long story short, that distortion is altering the internal organs and making them more susceptible to injury. So what was the injury for the twins? The mother came up with the correct answer. Because of this detected hernia with one of the twins, they were ultrasounding her fetuses every week to monitor to make sure there wasn't an emergency that was developing with this big hernia. All right. Ultrasound is a very powerful impacting force. We know it affects unborn children. And the fact that it was done so frequently, this impacting ultrasound that was going into their bodies, fetuses and infants have a very large spleen relative to their body cavity. And so their spleens were even more vulnerable. Long story short, I corrected the injury, released the torsional strain. Within, I think it was 3 or 4 treatments, they went back to have their blood reviewed. Everything was normal, right? They never needed another injection. So years later, I followed up on them, and they're still referred to me as Doctor No More Needles, because I don't think they enjoyed that intervention. But these are the kinds of things we're seeing with cardiac function, liver function. We see normalized liver function and reduced liver enzymes when they're elevated. Cholesterol levels are improving dramatically. I had a researcher from Harvard I worked with a number of years ago who verified that we were normalizing, because the chest wall is also injured with rib cage injury and upper back. The heart is very vulnerable to that. So he noticed we were normalizing cardiac arrhythmias and murmurs and regurgitations and all these things. He tried to get funding for study, which unfortunately we didn't get. But nevertheless, it's a very common presentation for cardiac arrhythmias due to post-traumatic event. Could be a fall, could be an impact. Many cases like that we've seen over the years. So yeah, that's the structural stuff. So from a structural point of view, many of the peripheral joints, the knees, and so on, but also the neurological structures, the internal organs. And when I talk about the internal organs as basically being like a fluid-filled structure. And by the way, just a quick little reference to the matrix. This little toy is a good representation of what's inside our cells. All right. And it's the cytoskeleton, which is basically a combination of proteins that determines the shape and functioning of the cells, aligns all of the various organelles within the cell so that they are very efficient. And when there's an injury, based on what we now know about many proteins, is they actually change their shape. They expand and become less conductive and become rigid. Dr. Ingber verified that in his studies, okay, at Harvard many years ago. And that extends out to the extracellular matrix, which is a very similar fibrous framework between cells.
Before we get into that, please, I'd just like to back up to provide some context for our viewers, because
sorry about that.
Well, no, it's great. I think you provided some really incredible stories as to how you were able to treat people, and I'd like to talk a little bit more about the specifics because now you have a few different modalities as far as I'm aware. But I want to touch back to bones and fascia and the matrix, the extracellular matrix and everything, because there's a couple things that I really like. I like how you can get a sense of something being true when it keeps kind of circling back to things. And that is really evident with the body because, for example, you talked about stem cells, you talked about low white blood cell counts. like all those cells, red blood cells, are all created in bone, in the bone marrow. And bones are really one of the main centers of bioelectricity in the body because they are made of collagen. They have the apatite that surrounds them, so it forms this conductive and also at times resistive kind of boundary, this interface, you could say. We know that if you apply mechanical pressure to bone, it releases a bioelectric signal because of piezoelectricity. Same with fascia. Any of these things that have semiconductive properties like collagen and fascia, because of the embedded free copper ions in them, the free electrons that can flow. And the other thing, so that all kind of tells you that there's something to this. Once you just learn a few of these pieces, many of which you just laid out brilliantly, you get a sense of, okay, like here's how this is working. The the other thing that I like too is that it presents multiple ways to kind of work with the problem if you have one. There's this like physical kind of centered approach where you're actually working with the body directly and therefore you're manipulating the bioelectricity. And then there's also this approach where you can use more scientifically, not scientifically based, but more electromagnetically based interventions. For example, you have some of these magnets that we'll talk about in just a little bit. You have your Schumann resonance generator that we'll talk about as well. And they kind of both get to the same destination. Ideally, you're using both protocols at the same time. But I mean, it's just a simple example that I can point to from my own personal experience is that ever since I was about 19 or 20, I started doing a lot of weightlifting and I got into powerlifting. You know, you put heavy weight on the body, that's mechanical strain and pressure. And when I started getting DEXA scans, which tells you your bone density, I was doing it for body composition, see, you know, lean body mass, muscle, fat, whatever, but it also tells you your bone density and your Z-score. My Z-score was a 3, which is like 3 standard deviations above normal because of all the intense weight I was putting in my body. And so I was literally remodeling and shaping my bone and therefore working with my bioelectricity that way. And I think that working with your bioelectrical system through just actually physically manipulating your body through exercise, through fascial repatterning, all these things, chiropractic adjustments, right, is tremendously beneficial. And then if you add in some of these other things like this alternating polarity concentric magnet that you have, then I think things get really exciting. And we see also with bone that if you, like for example, you have like a salamander, like Robert Becker has an amazing book that he wrote on this, The Body Electric. Anyone that is into this needs to read this book if they haven't done so. But you can take a simple organism like a salamander and cut off its limb and it'll completely regrow. It generates this current of injury where now you have a change in that voltage gradient, and that seems to repattern and guide the body in terms of regrowing that limb. And that gets reduced as you increase the complexity of the organism. So we have a very weak current of injury, you could say. But perhaps some of these modalities can kind of improve that and for more localized areas as well. So it's really it's really fascinating how the two work together.
Actually, there's an interesting extension of that. There are a couple of reports of people who've lost the tips of their fingers or thumb, and they happen to have, in a couple of cases, the opportunity to have someone apply harvested extracellular matrix from pig's bladders, for example. And they powderized it and they basically placed it over the area and bound it on there. And within a short period of time, I don't know how long, they regrew the tip of the finger. And in one case, a young child regrew their thumb. So we know we're capable of it if we reestablish that communication, right? And so all of this is, you know, except for the, you know, when I think about those extreme examples, but internally, we have the ability to heal, but we have to recognize, we have to create the right environment, right? And just like you said, this combination of the bioelectric support along with the physical support, this is why we know astronauts are in a mess if they're in space for a long time and they're not exposed to the Schumann frequencies and gravitational pressure, their bone mass is horrible. right? And they also age relative. They did a twin study a few years ago where a pair of twins were monitored, and they noticed, significant biological changes in the twin who was in space for a long period of time. So yeah, these principles definitely come into play. And, I think that recognizing our own ability to heal, whether it's through exercise or through, I think we have a powerful ability to do it through visualization, but also recognizing that we need to also do things to support the right environment. That's not just, nutrition, it's internal, it's external, our electromagnetic environment is really, really important. And so it's part of the education process that we need to recognize and help other people understand. So if I can just go into this concept now, I think if we can, I'd like to talk a little bit about the bioelectric side of what we talked about earlier in terms of all of a sudden we were having challenges normalizing or even detecting these injuries. By the way, the magnet technology is something that I think is related to an old technology that's been around for a long time.
And just
The
before you do
base,
that, please, George,
sure,
just could
yeah,
you just quickly share, because I would love to get into that, but you
no
talked
problem.
about how some of your students and those you trained were able to
Yeah,
help people overcome some of these problems. What
yeah.
specifically were you doing? Were these mostly chiropractic adjustments, or what was your
No,
actual?
no. So if people want to learn more about the techniques that we are using, they can go to matrixrepatterning.com. It's a very, very gentle pressure that's applied specifically to areas of injury. And what you said about how energy is absorbed into the body, the dense structures like bone, all right, will absorb more energy. And even more dense than bone is the fluid containers like around the organs, pelvic cavities, cranial vault. These are all fluid filled structures. So if you think of a water balloon, basically a water balloon has a similar structure around it. All the organs do. And if you think of that being filled with water, when you drop that, when it's impacted, it's going to suddenly expand like that. All of that force of the fluid, because it's non-compressible, is going to be transferred to the organs, to the
Hmm.
surrounding bone structure. And so every impact that we have that affects those fluid cavities, I really say there's two impacts. One coming from the inside if we fall or in a car accident or a sports injury. And the second one is the outgoing impact that affects the organs, affects the bone from the inside. And so those are kinds of things. And then, so what we do therapeutically is we identify those areas, okay, because they actually show up on our testing as a bioelectric fingerprint. They literally lose their conductivity. And so by applying a normalizing field, they actually will take those areas that are rigid and tight and relax them suddenly. Like it's really dramatic.
Hmm.
Everyone can test this for themselves. And early on, I realized that we produce a lot of bioelectricity. And the more nerves, for example, in your hand, there's a lot of concentration here, you're going to produce a fairly strong bioelectric signal coming from your hand. So what's the first thing you do if you bump your knee or your elbow or your head? You're going to put your hand there. We do it automatically. We don't even say ow, but it feels better.
And we apply pressure too.
Pressure, we probably do,
Yeah.
but even just placing the hand, it's interesting. And even people have done, things like Reiki and therapeutic touch where they don't touch the body. And I believe they're applying a field, and some people can generate a stronger field. I think we'll call them healers, like they do this. We know this is true. But we are all healers potentially when we recognize our power. And it's really about applying the things that Mother Nature provided, but we have to recognize that now we've kind of changed the environment. So there are things we have to compensate for now because of the environment we've altered. And so along the road, my practitioners use a combination of the gentle pressure that we call containment. Okay, we just literally just very gentle. It's surprisingly gentle, but you can actually test this yourself. If you put your hands together, for example, you can try this yourself, Stefan, and put your hands together and just apply gentle pressure. Close your eyes And notice when they kind of equalize, okay? And you'll feel kind of a flow or like a little bit of a tingly feeling coming into your body. And I call this applied Qigong. I used to teach Tai Chi and things like that. And these principles go way back.
Yeah.
This is nothing new. It's really similar to the meridian therapies, acupuncture, stimulating that bioelectric current. We can do that with gentle pressure. And then a normalizing field, which we believe this specialized magnet provides. And so the structure of that magnet is unique in that it has alternating polarities, okay, which creates a gradient that travels through it. And when it's applied to the body, it stimulates that microcurrent as well. And that's something, there's 4 double-blind studies on a earlier version of that magnet that show some benefit in terms of pain. And so we think it does a lot more than that, of course. Oh,
So
okay, so that's
so
how
it's a combination of the pressure and then
containment,
also
and
the
then we call it
magnetic field.
entrainment. So you're applying, so we call it, say, a containment plus entrainment to stimulate that natural bioelectric flow that you basically is natural to your body's ability to heal and reestablish communication, right?
Yeah,
So
interesting
it's
about
remarkable. It's so simple, really, when you think of it, you know?
yeah, and I like simplicity because it gives people something that they can do themselves. And
Absolutely.
before I got into really this specifically, again, I mentioned I started working out at the gym when I was like 19 or 20. Well, there's a guy called Kelly Starrett, and he's very popular with the CrossFit circle. And he wrote a book called The Supple Leopard. And one of the big things that he really swears by is something called voodoo flossing, where you take a latex band and you're going to wrap it around a joint and you apply different levels of pressure. I typically will do like a 7 out of 10. And for like a couple minutes, you mobilize that area. You move it through full range of motion, different ranges of motion, and you create, you're putting a lot of pressure on it. Maybe this is more so than the gentle pressure that you're using, though you're also using that magnet, which I want to talk about. But then you remove the band after like 2 minutes and you get this rush of blood into that area where typically like collagen or cartilage, right, is a low blood flow tissue. And this seems to really heal joints. I've used this now for years. There's one time I had a pretty bad knee problem on my left knee, but I just started like this progression on squats, and I was able to completely heal that up while still doing squats like 3 times a week. So normally you'd want to lay off. I was adding weight and the knee got healed. And so anytime I have an issue now, I just voodoo floss that joint, and these bands cost like $20. So it may not be the complete therapeutic modality that you use, but that's something that anyone can do. And by applying pressure, now we know that if you apply pressure to like an area like that, you can actually stimulate chondrocytes to produce more collagen. These are the cells within a collagen matrix or cartilage that put out collagen fibers on all sides of them. They're pretty far apart from each other. It's interesting because, again, blood doesn't flow easily through there. There's no actual capillaries that go to chondrocytes. It's only osmotic for the flow of nutrients into them. But an electromagnetic field doesn't have really any limitations unless the tissue is resistive and it's not conductive. And collagen, as we discussed, is very conductive. And so you could get that bioelectric signal in there very easily by creating that pressure. And really, collagen and fascia and all this, right, the matrix, is just like almost an extension of the bone, which are, again, these centers of bioelectricity. So I just love how all connected it is. And then you can start to apply more advanced techniques like this magnet or just like biomagnetic therapy. But really, this magnet's not that complicated. Can you go into that?
No. Yeah, well, first of all, just to back up,
Yeah.
I mean, the book I wrote on matrix repatterning is a self-help book, things that you can do for yourself. That came out in 2005. I think it's out of print now. Some used copies are around, but I'm working on a new book and it's some programs to train people to treat themselves and their family members. There's very simple procedures that anyone can apply. There is a video online where I show treating the leg and the knee you can do for yourself as well. So you're talking about that flossing, very, very makes perfect sense to me. You're applying pressure and movement, and you're stimulating that intracellular communication. That's very key to exactly what we're talking about. So using the mechanical component and the bioelectric component to me is a wonderful opportunity. And your hands produce that too. Placing your hands over an area and applying that pressure, you can do that to a large extent. We have created a home version of this magnet. So this magnet, as I mentioned before, has these unique properties, but we do have a home version that has a smaller profile. It comes in a little kit that we have as well. It's encapsulated. It comes with different straps that you can apply to different
Right
parts
on.
of the body. So people who have deteriorated joints in their low back or their knee, often the cartilage breaks down. This will stimulate repair over a period of time. We call that the matrix mag. So, I mean, that's just something that is very easy, inexpensive intervention that anyone can apply. All right. And so the magnet technology certainly was a huge breakthrough. We were using microcurrent devices prior to that, and we were using pulse magnetic field devices, but they were very cumbersome and very expensive. And so this magnet just came along by chance, because magnets in general, I abandoned years ago. A static magnet in general, because of the way it's configured, you mentioned the Hall effect and how that changes things. It's really essentially going to push things in two directions at the same time, because it's bipolar. It creates a bipolar effect. It's like driving a car, my analogy, crude analogy, driving a car with your foot on the gas and the accelerator and the brake at the same time. So basically, you're not going anywhere. This is unique. This magnet is unique because it creates a cascade across a large field, and that stimulates the body's own electrical current. So that's what we think is happening. It seems to be measurable in terms of its therapeutic effects. And then when we apply a magnetometer, we can see that fluctuating magnetic field as well.
This is
So,
a mixed polarity magnet. So you have a
yeah,
positive, like let's say the center is positive, and then the outer
yeah.
ring is negative, and so on and so
Well,
forth.
they're alternating. Yeah. So
Yeah.
there's a big gradient between these poles that seems to goes deep into the tissue and drives this current. Okay. So that's our theory at the moment, but we can see the therapeutic benefit right away. And when people look at their bone structure, for example, if people watching this video, literally just take your thumb and fingers and check the size of your knees, or check the size of one shoulder compared to another, you'll notice pretty quickly that, yeah, one's bigger than the other, because guess what? You fell when you were 11, or you fell on your knee. How many people have it, or on their hip? And so we see so many people with hip replacements and knee replacements, and we've been able to prevent a lot of them. I've worked with orthopedic surgeons on this as well, who basically are realizing that we are actually taking people even who've had a hip and knee replacement, and then it becomes unstable because the bone's been really traumatized. Applying a little bit of treatment to that bone helps to stabilize it and helps to reintegrate the bone to the prosthetic knee or the hip, and all of a sudden they're way more functional. So we're working with a few orthopedic surgeons on this to see if we can improve the outcomes of these surgeries, or even prevent them in many cases as well. So that's really, our goal is to get this out to the world, get it to people so they can use it on their own, teach practitioners to do some of the more advanced techniques, which are sometimes very complicated when it comes to head injuries and so on. But there are many, many things people can do. But I will just mention now, like I said, about 8 or 9 years ago, we started to encounter problems and realizing that the magnetic fields were interfered with. And that's when I had to do something to get to do an intervention to allow us to do our work. And I realized, I started studying the Schumann frequencies. I said, well, we can't block all of these Wi-Fi signals and everything else. It's impossible. You live in a Faraday cage. Essentially, we know that that's not great either. We see people, they've done experiments where they put animals in Faraday cages and they start to break down because they're not getting the Schumann frequency either. So I think I said, okay, let me look at some basic, simple devices that might be able to stimulate Schumann frequency and maybe broadcast that out into a larger field. So I worked with a group of scientists, physicists from University of Toronto, and some other engineers. And we came up with a device which we call the Safe Zone. And so I did it for our practitioners. I said, guys, you need to try this, see if you can improve your outcomes. All of a sudden, they could find these things they were missing. They could treat more efficiently. Great. Then one of my students lent it to a friend of hers. This goes back about 3 years ago when we first started developing the device. Her friend's son was born with a brain injury. He had epileptic seizures from the day he was born, 10 to 20 seizures a day, severely compromised. By the time she gave him this device, he had had seizures like that for 17 years. He was 17 years old. Within 24 hours or less of turning on the Safe Zone, he stopped having seizures. It's like, oh my God, we have something significant. He basically had almost no seizures now for 3 years. All right. His life has been completely altered. And so we realized we need to do more studies. What are these electromagnetic fields doing? And that's when I got involved with Dr. Magda Havas from Trent University. Dr. Deutsch also got involved even more so at that point because it was pretty profound effects. And so we started doing studies on brainwaves, looking at EEGs when people were in a contaminated, polluted environment compared to when the Safe Zone was turned on. And the scientists who developed this form of EEG were quite surprised because back-to-back testing typically would cause a deterioration of the brainwaves. These were improving. You could actually see they were improving. So I said, okay, there's something measurable here. And so we've seen people with chronic issues like tinnitus. The mother of this young boy, by the way, had tinnitus for 20 years, and that disappeared completely with the Safe Zone as well. And other people with chronic migraines and sleep disorders, anxiety disorders. These are the kinds of things that we got excited about. And so now we've made this available. It's a device that you can purchase, and there's no risk to try it because we stand behind it. There's a 90-day trial period. If there's no benefit, then just return. But I would say it's worth looking at only because I feel like we need to do something for ourselves to improve our local environments. And so I'm not saying this is the only thing we can do. Of course, there's many interventions we can do to reduce our exposure, but it may be something if you can't avoid, because you're living in a condo or close neighbors or towers all around, it seems to be benefiting people in that way. So I didn't expect that. It was kind of a shock, when I started hearing all these clinical stories about people improving many of these conditions, but it started to make sense, and I think from your point of view, you're looking at these human frequencies and realizing how important it is for our health. But the reality is we now are living in a world technologically that is gone, off track, in that sense. So the grounding is great, and all those things are huge in terms of helping our bioelectric health.
Well, I have a couple questions. First off, do you have is it like handheld? Like how big is this Safe Zone? Is it like a box?
This is it's booting up again. I just plugged it in over here. So it's got a little screen up there. It's got a programmable features here where you can adjust the intensity. You can adjust the time of day. What's unique about it is as well, because the Schumann frequencies change during day and night. The lower frequencies are introduced during the evening. So what I realized is if we can duplicate that, you can actually set it to come on at a certain time during night into what's called the rest mode. So it'll shift to the lower frequencies, roughly 3.5 to 7.83. It'll kind of alternate between those frequencies. And then during the day, it's what's called active mode. You can program it to when you want to wake up, like a natural alarm clock. And so that will basically then shift to the higher frequencies ranging from 7.83 up to 21 point something, I forget. But it's a series of frequencies that duplicate the normal Schumann resonances during the daytime. So we're experimenting with different frequencies all the time. We think there's benefit to the gamma band as well in people with dementia.
35 plus hertz.
35 plus, exactly. So that's another device that we're working on now, and we're going to be testing that out over the next month, 6 months or so, to see how that might help people
So
in those
that's
situations.
so that's a device that you put in your house, and it'll basically blanket the entire house, though the
Yeah,
field intensity will diminish as you go further away. That's just
absolutely.
electromagnetism 101, the inverse square law. But what is the you said you can adjust the intensity. Like, do you have the actual values for that you can provide? Is that
I don't have the values my engineers do. It basically is not an area that I'm that versed in. All I know is that there are people who are really sensitive to these fields, and so we decided to add a lower intensity level for them. And so we've had cases where people turned it on initially and felt agitated, and they had problems sleeping. And so there's not a lot of cases, but people like that. And so what we've done then is say, turn it down to a lower intensity, and they were able to adapt to it, and then gradually bring it up to the higher intensity. But their nervous system, I feel neuroplastically, had adapted to the high frequency. And so even people who are living in those environments, and they suddenly turn off all their devices, they have a similar response. And I think other investigators have noticed that. So the safe zone is no different than that, because it's suddenly turning your internal neurological frequencies, let's say, supporting a lower frequency adaptation. It's still a disruption for some people, to the
yeah.
point where if their nervous system has adapted, it may take sometimes between 3 to 5 days is not unusual. And then ultimately they love it. And we've had cases where animals who are really agitated and scratching and not sleeping through the night, pacing, they calm right down. We have a great example of one of my students whose dog, a big giant schnauzer, would always go to its lovely bed. We have a picture of this dog on its bed, and lazily lying on its bed, would never leave that bed at night. As soon as she put the safe zone in, it wants to be near the safe zone. So it'd be on the hard floor, doesn't matter. Wherever the safe zone was, that's where the dog wanted to lie down. And we've had cats responding who are feral cats who would never come out of their hiding place, all of a sudden socializing and acting like, a loving member of the family. Like, it's wild. So animals are definitely responding to it as well.
Yeah, it seems to have some sort of normalizing influence over brainwave patterns. So be
Yeah.
interested to see that research that you have, whether it's published or preliminary still, if
Yeah,
you could
it's
send that my
preliminary at this
way.
point because it's a very, yeah, so we're just still collecting data. We're working with a team at the University of British Columbia who are basically have developed technology. So we hope in the next year or so be able to publish some of that material. But we have some preliminary studies that are very promising at this point.
Yeah. And it's it's interesting because I mean, yeah, we're just inundated with all these EMFs right now. And we do see larger macro changes in our environment. The field strength for Earth's magnetic field has gone down about 10 to 12%, maximum 15. There's variations across the globe
Right.
since about 1850, and actually going back beyond that, going all the way to like 1000 AD, the field strength has been going down. But across the geologic record, it is still quite high. There's been most of the time periods in the past, it has been actually weaker, but still based on just recent time, especially if you go back to 1850, before the advent of power grids, and now we have all these other microwave-based and micro radio frequency-based devices and energies that we're emitting, it has changed. So there's this macro shift in the magnetic field. And I mean, for example, now we're putting all these satellites in space, and that's, I think, just starting to begin to affect the geophysics of the Earth. And then we have our more local scale alterations to our background energetic environment due to cellular frequencies, radio frequency technology, the explosion of power grids, 50, 60 hertz noise. I think some like rail lines run at 27.1 hertz or something like that. We're just taking our entire environment and raising up huge swaths of the light spectrum in intensity, whereas before you had geomagnetic pulsations, which would turn on every now and then from a storm. That would be less than 5 hertz. You have Schumann resonances, which are pulsating in the background consistently 24/7, 365, that whole deal, at 7.8 hertz, roughly 12 or 14, 20, 25, 26, 33, so on and so forth. They diminish. And then we have like solar radio flux, like 50 megahertz to 1,000 megahertz or so, but that's kind of transient. You have these solar radio frequencies. They change from solar minimum to solar maximum, but again, the intensity is quite low. The Schumann frequencies in the magnetic field are only like 1 to 10 picotesla in strength, which is incredibly tiny. And that's why I think it's important to be mindful of the intensity of some of these Schumann resonance generators, because they'll use an intensity 1,000,000 times greater than normal. That might be too much. But regardless of that, and then of course you have like infrared, visible light, ultraviolet light, and the other parts of the light spectrum frequency. But we filled in large swaths of the radio frequency spectrum where typically there wasn't anything naturally being produced unless there was a thunderstorm nearby. And so it's interesting to hear your accounts of how that has been observable, like physically, like babies turning in the womb, right? Fetuses spinning in the womb, trying to get comfortable and set. And then how there's long stream effects from that, because that's when the body is literally creating itself and building its format and its structure. But we also, before we jumped online, we talked a little bit about, we just touched on it, infrared, and how amazing receiving infrared exposure can be. Just like, for example, sunbathing gives you a lot of infrared, but specific wavelengths of light in that, either like close to infrared in the red light spectrum or infrared, seem to really have a profound benefit for health in terms of working with mitochondria more. So is there anything that you'd like to share there?
Oh, it's an area that I'm really just exploring. I would not consider myself an expert on that. One of the people I follow, who I think is a great resource, is Dr. Roger Shehalt. I don't know if you've heard of him. On MedCram, he has a website, is a medical education website, and he has explored that at great length. And there's quite a few studies, I think, now that he discusses on the benefits of infrared exposure. And I think that's something we just have to recognize, that in a natural lighting environment, we would basically be exposed to red light, infrared, much more so than many of the artificial lighting sources we have now, which basically I would say are causing possibly neurological effects, but also causing weakening of the mitochondrial reproduction and mitochondrial activity. And one of the little insights that I had, because I like to look at nature, okay? So how does nature solve things, okay? So in the northern parts of Canada and Siberia, we have the native populations who are living in very cold environments, low light environments, where they don't get a lot of infrared, right? But they've been able to adapt to their environment, and they generally are quite healthy traditionally. I would not say that's maybe true in modern times. But if you look at a traditional, Inuit living in northern Canada, what they would have done during the winter, they would have been in an ice house. Okay, some people call it an igloo, and probably for 12 to 15 hours a day, they're in there around a fire. Okay, and so they're probably maintaining that support for their health through that. And they may not have realized it. Of course, scientifically, they wouldn't have recognized it, but they know if they didn't keep that fire going, their health would have gone downhill. Mind you, they would have frozen to death for sure. But, there's so much that we need to learn about how nature provides everything we need, from the food to the microbes to the light to the electromagnetic support. It's just incredible. And to me, that's always been my excitement and passion. How can we educate people to come back to understanding how we interact with and live in a natural environment that has everything we need? And the further we diverge from that, the more we pay for that in terms of our health. And so, nature has provided everything, and we just need to pay attention and learn, how to reconnect to all those principles,
Well,
which
it's
you're teaching.
interesting. It's interesting how it goes. It all usually seems to go back to the sun because we know that, I mean, everyone's done this. You go to the beach, you lay out, and you're
Mhm.
getting a whole bunch of infrared from the sun. I mean, most of the energy from the sun is in the visible light spectrum, infrared, and then also the ultraviolet light.
Yeah.
So you're getting a whole bunch of infrared heat. You can feel it. Um, if you're in an ice house and they're not burning wood, they're burning probably something like seal blubber. That fundamentally is energy that came from the sun, though, because the seal ate some fish, and the fish ate some smaller krill, maybe, and the krill ate some plankton, and the plankton photosynthesized that from the light of the sun. And
Yeah.
so they're not receiving that much sunlight because they're in the far northern reaches and it's winter for them, but they are still receiving sunlight just through this uh, kind of differentiated mechanism where it had to filter through life to then eventually release its energy again. So that's a very simple way to think of it, which I think really kind of helps to connect things, at least for me. And I
Yeah.
find that really interesting. And another very simple one too with mitochondria. I mean, there's so many people out there without us going super into depth on it because we can't say I can't say I'm an expert on it. You said you can't say you're an expert on it. We just both find it interesting.
Mhm.
But there's a wealth of information out there as in terms of the importance of mitochondrial health for our health and wellness. They have their own genes. It's very interesting, but they are the energy centers of our body, of our cell. They run on what's called the electron transport chain. They literally run on electricity because electrons is, one of the fundamental blocks of electricity, the flow of energy. So I just love how it all comes back together, and you don't need to be a PhD to just kind of see some of the connections when they're put out very simply for you on the table.
There's one other component of light that I think we could talk about here too,
Yeah.
which is one of the main receivers of light that actually activates our entire endocrine system, which is the pineal gland. And we know from many studies and from other anecdotes that the pineal can deteriorate over time when it's not getting sufficient stimulation from light. And I remember doing studies when I was in university on chicks where we would basically cover their eyes. So they basically to see if they would stay within the normal diurnal cycle, right? And they were fine until we painted their heads black
Mm.
and they could no longer receive light to the pineal gland. And they started to drift out of alignment with their diurnal cycle. We could actually track that. So we don't recognize it. We don't see the pineal gland. It's a little tiny bead inside our head. But when you look at many of I think there's many other implications to the pineal gland when it comes to our spiritual focus to some extent, our ability to connect inwardly to what's going on between us and whoever is running the show here. Let's say we look at the human body and say, okay, this is who we are, this is our brain. And many people have said the brain is not a transmitter, it's a receiver. you know and the pineal is a receiver. So what is it receiving? Who's the broadcaster, right? So many things that we need to reconnect to. And if you look at traditional cultures, they have so much wisdom when it comes to living with nature, living with a connection to spirit, whatever you want to call it, universal consciousness, whatever it is that creates life, because we still haven't figured that one out. So, the idea of the chicken and the egg, is a good one. I actually wrote a novel, which I shared with you earlier, but one of the things I comment on there is the answer to the chicken and egg dilemma. What came first is, I would say, it was the intention of the chicken and the egg, that created this entire
Mm.
framework that we call life, right? So that's one way to consider it. So, like I say, and like you are saying so much in what you're sharing with your viewers. We need to just recognize who we are and what we're a part of so we can reconnect to the truth and reconnect to the things that are going to support our well-being. And it's all there. You just have to pay attention. So I really want to thank you for your part in that. You've opened my eyes to so many of the principles that I think are really crucial to our understanding during this particular moment in history. So I just want to say thank you for that.
Well, yeah, and thank you for jumping on to the call, and for us having this podcast together. I mean, one of my philosophies is that, and at least for me, once I learn something, it's pretty difficult to go against that if I know something's not good for me. Um, and it's very simply, knowledge is power. So it's just learning these things, putting it out there, building the connections, and then doing that in such a way that other people can just get it. Things don't need to be complicated. You can go into depth. There's endless depth. The universe is fractal. You can keep going down, down, and down, down. But if you get the fundamental truths, and that's enough for you to make some sort of shift that's necessary, that your body desperately needs perhaps to realign and be healthy, then it all just kind of clicks together. And I see the connections with the geophysics and the biophysics, or you can also say bioelectricity. There's really no distinction between us and the earth. Like, we are the earth. Sometimes we split ourselves off, and you can make that distinction, but fundamentally, anything that's on earth is the earth. And we have so many similarities with the earth, like, we're 70% water. The earth is like, the surface is 70%. Some of these you could just chalk up to coincidence, but then you just start to examine it more and more. You see how the earth has these electric currents that flow through it. We have these electric currents, and I mean, it's just really incredible. Again, the earth produces Schumann resonances. Our brainwaves are the same. Like, you just know that there's something there. And so being mindful of that. And then once you know that, for example, like, cellular frequencies aren't good for you, then you start to turn your Wi-Fi router off at night. It's very simple to do. Or better yet, you don't have one. Like, I don't have one in my apartment. I use Ethernet. Of course, all the apartments around me do. But it decays via the inverse square law. It helps not to have all these things. And so, yeah, I think we had a great conversation today and touched on a lot of stuff. And I'm glad that you shared so many of those stories, and also the fact that the protocol that you use in general was fairly simple, because I think that provides a lot of hope for people.
If people do want to learn more, by the way, about matrix repatterning, and we're going to be providing self-help programs there as well, they can just go to matrixrepatterning.com, by the way. All right. And there's a lot of information there, videos show you how it works. And to explain that, I know I'd love to get you connected to a practitioner. It tells you where to find a practitioner. We have practitioners all over North America, and a few in Europe now, Australia, New Zealand, and so on. So we're training professionals, but we also want to empower everyone to be able to provide that for themselves. Okay. And then the products, by the way, are on another, can I share that website?
Yeah, absolutely.
Yeah. It's wellnesssystems.com. Okay. So there's 3 S's in the middle there, wellnesssystems.com. And there's no risk to try some of these self-help devices as well. So feel free to have a look at that. And then I'd love to hear back from some of your viewers. And certainly I'd like to invite you to check it out too, Stefan, because I think you'll find it might be helpful to support your well-being. And I know you're very focused on being well. So
yeah, I'm definitely going to pick up some of those alternating polarity concentric magnets. Those look awesome. I'm really excited to get my hands on some of those. So yeah, George Roth, that's George Roth, everybody. Thank you so much for jumping on the podcast and for sharing some of your wisdom and experience with all of us, some of your observations. And I'm sure we'll have you back on at some point to talk about bioelectricity some more.
All right. Appreciate your support. Thank you.
Thanks so much, everyone.